Hello and welcome to our Friday webinar. We are on with Dr. Tom Tully. Welcome, Dr. Tully.
Well, hello, Laura, and happy holidays and Merry Christmas and all of that good stuff.
Yeah, no, do you wear this attire all December or?
No, like only on special occasions like today. But I have it in the office to, give some ambiance and festive cheer when you walk in, so anyway,
kind of like a deer that got caught up in the Christmas lights, right?
Exactly.
Which happens apparently. So
yes, and you see what the antlers are good for, putting lights on them.
There you go.
Who knew?
That actually would be a kind of a cool, if you had not like real antlers, but you could have your bird perch.
Yeah,
one that came out like there you go. So all right, love it. Wow, if you're just joining us, we are on another great episode of Ask the Vet with Dr. Tom Tully. I can't wait to see what we unravel today, health wise and well-being wise with our pet birds. So a lot of good questions, I'm sure.
Yes, always.
Let's see, and just a gentle reminder, a nudge that if you do have a question, to use the Q&A button and not the chat feature. So wait, just real quick, do you have, is your house all festive for the holidays? Like, and how does your flock respond to that? Do they?
Yes.
Are they like, what the heck is this?
In our neighborhood, we have lights on the outside, and it seems like you take them down and then it's time to put them back up again. It's the year passes rather quickly, but no, it's kind of a older neighborhood, and so have lights and everything. Everybody does this, and so you're kind of somewhat obligated to, or not necessarily, but people would wonder, well, why isn't their house not decorated? But anyway, so I hope the same for you and in California.
That's so, yeah, it's been chilly here. It's like in the 40s, so we're not used to this.
Well, seasonal weather there.
There you go. I'm enjoying it, although we don't have really a fireplace to enjoy it by, but yeah. And I guess, if you do have a fireplace, there is some cautions, right, with birds. If you have fireplaces that you're lighting up, especially for the first time of the season, there's some precautions that you need to take, right?
Oh, well, yes, you always want to make sure that the flue is open. That's the first step. And always never leave the fire unattended, because a log could roll off and then you get a lot of smoke in the house. So that, along with heaters and carbon monoxide monitors and things of this nature, is very important, not only for the birds, but for the humans in the house as well. Yeah. Very much.
Do you ever see a bird that's like a wild bird that's come in that had a nest in a chimney, and someone, like, I've heard of, birds nesting in chimneys?
Not during the winter, but in the spring and summer. Chimney swifts, they build their nests in the chimneys. Of course, we've had a number of those that have fallen down the chimney with the babies in them, but never a situation where we've had a bird within a residence chimney. We've had birds that have flown over stacks that have been the feathers were singed enough that they couldn't fly, and so but those are industrial size stacks that have heat coming out of them, and just then got a little too close. But
wow.
Yeah,
just for comfort. We are getting some comments about your hat. It's hilarious. People are like, what is that? It's like,
well, it's a holiday hat. It's a holiday hat. Yes. It's not a Santa hat. It's a North Woods hat.
All right, mystery solved. I got some gnomes here. All right, so we better kickstart these questions. Sorry. And I do have, let's see. So we did get a question, and it's something that I think that's apparently has come up more than once, and that's about root vegetables and heavy metals. So do you want to kind of delve into that a little bit on?
Well, I'll say that obviously there was a concern. Somebody had wrote in about root vegetables and heavy metals. And of course, you hear about human food contamination from time to time, especially with bacterial organisms in lettuce and peanut butter issues with salmonella. But as far as heavy metals in root vegetables as being a problem, that is not a concern and shouldn't be for yourself or for or your birds for that matter, unless we get information that we currently do not know or have. Things can change, but from everything that we know and that there isn't a concern, or there shouldn't be a concern. I've never had a situation where I said, oh, those carrots, they're the lead levels in those carrots are just out of the, through the roof. No, never have, and I don't expect to. And thank goodness for us, because we eat those. You're buying them from the store for us, and so we're not talking about processed foods. We're talking about food that is unprocessed, and so straight from the ground. And so there shouldn't be any concern there. All right. Hopefully that sets that.
There we go.
Straight, unless we hear something that they tested some vegetables from someplace, and lo and behold, that's the case, which is always possible, but no evidence of that, and never has been in my 35 years of practice seeing a bird with that. A lot of birds that have been fed root vegetables. So hopefully that puts that to rest.
Okay, there you have it.
Yeah.
All right, and then so we have a question for you about a Alexandrian parrot that has some feather destructive behavior. So they're mostly feather chewing with some plucking. 5-year-old, we're talking about a 5-year-old bird, and this started about a year ago. So they're saying that all the blood, all good blood work wise, except for the acceptance of bile acids. So in March of last year, the bile acids were fine at 28. You're gonna have to help me here. UMOL/liter.
Micromoles per liter, I think.
Okay, that sounds right to me. So 6 months ago, they came back elevated, and they repeated the blood work to recheck the BA, and it came back even more elevated. So he's been on milk thistle, lactulose twice a day, has flaxseed twice a day for the last 6 months. They switched him over to flaxseed oil to Vet Omega and provided, let's see. So good. He has a good diet with, fortified pellets, supplement with vegetables, seed in the diet. So they're wondering, what could be going on here? They're planning on doing a heavy metals. Oh, speaking of heavy metal screening, and discuss scheduling a CT scan.
Mm-hmm. Well, just my thoughts. It sounds like the veterinarian that she's seeing is doing a good job in trying to assess the bird and trying to determine the feather destructive behavior. It doesn't appear to be as bad as it could be, but still is problematic. Bile acids. So somebody says, well, what does that mean? Well, it's a test basically to look for liver function. How well is the liver functioning? Sometimes that it's done after the animal eats, or sometimes it's done, with the animal being fasted. And with birds, it's not, we really don't look to determine whether they've been eating or not, but you can. But in general, it's liver function. It's very difficult to determine subtle changes in liver health, because there's enzymes that are produced if there's inflammation, and inflammation of the liver is called hepatitis. People may have heard of hepatitis. Well, itis, inflammation. So the hepatic liver hepatitis is what that is, and if it's liver in general, there's enzymes that are produced that you measure, and that's why it's so important to do what we classify generally as blood work, but there are specific tests. We've talked about the complete blood count to look for inflammation in the body, and you can also see if the bird's anemic or not, looking at the red cells. Also, there's the plasma or serum biochemistry panel, and that determines the blood glucose of the bird. And you say, I'm hypoglycemic, I can't, I'm about to fall asleep, I don't have any energy, I need to eat something to get the blood glucose. And so we look at that, and birds that are diabetic have a very high blood glucose. So this is the plasma chemistry panel. That's why and then also you have the liver enzymes, muscle enzymes. You have the uric acid, which can tell if a bird is dehydrated or not. And so some of these kind of blend together, and it's hard to specifically see what's going on with that liver. But the bile acids will look for specifically the liver function. Now, you mentioned that initially so this bird has, and before I get into that, that's why I always say, when you're looking at the bird and you're trying to determine what's going on, if there's something wrong, the bird is not acting right, or it has this sign or that clinical sign, that you can see it, but you don't know what's going on inside the body. And that's why getting these blood parameters are so important. Just like for you go in and you get a physical exam, well, go get your blood work. And so you have to go get that so they can see what's going on inside. And so this has been done. And from what I'm to determine based on that question, everything's good, except this liver function test, bile acids. Now, first it was normal. The bird was obviously having some of these signs, but then it's normal. So let's run it again. So it goes from what? It's initially normal, Laura, to what?
Normal to, sorry, hold on one sec.
And it was normal, it was in its 20s, and then it went to like,
it said that the bile acids
60.
were fine at 28 6 months ago, and they came back elevated at 62. And then they repeated it yesterday to recheck the DVM, and they came back even more elevated at 80.
Okay, so these numbers to everybody who's listening doesn't mean anything. They're numbers, right? Because what do you need? You need to know what's normal. What's the normal range? And usually it's not for tests. It's not, everybody's a little bit different. And so they have a normal range. So you have the bile acid range. What's the normal? If you don't know what the normal range is for an Alexandrian parakeet, then the numbers don't do you any good. Just because they've gone up, that's somewhat of a trend and that needs to be addressed. But if you look at the normal range of bile acid, normal from published papers and parrots, 80 is kind of on the upper end of the normal range. Okay, now why is it going up? That's something that needs to, again, be kind of looked at, but everything else is normal. And you have the behavior, this feather behavior, feather destructive behavior. The aspect that I would look at that with everything there, I would look at behavior issues as far as feather destructive behavior. And Laura can tell you as much as I can that on the webinars, you can go back on webinars and they probably have 3 weeks of feather destructive behavior information on there. And so maybe 2 weeks, but nonetheless, there's a lot of information as it relates to feather destructive behavior. I think that, possibly looking at this and looking to see if there's anything clinically that arises other than the feather destructive behavior. But the bile acid at this time, I wouldn't get too excited about that. I would look at the feather destructive behavior and then go forward, because there's no evidence that there's liver enzymes that are elevated. There's no indication that there's specifically liver enzymes. If it's eating normal weights, maintaining weight, all of this, no other clinical signs of disease. There's just this one test that's still possibly within the normal limits, but kind of increasing a little bit. You could take it again in a month and it may be back down to 40, but it's still within the range, and it may depend on what the bird's been eating, what's been going on, the bird's general behavior that day on that. So that's the way I would look at it. And it kind of gives you an idea of when you get some of these test results back, and what we try to do is say, well, this is the normal range here, and this is what's going on. But one test result as it relates, without any other supporting issues or information that's abnormal, I'm kind of, I don't ignore it, but I don't focus on that. I kind of look at the bigger picture. There's something, and the bigger picture here is you have some feather destructive behavior that needs to be, make sure that that's addressed on that behavioral issues and things that could possibly be causing that. There you go.
All right. Hey, so just real quick about blood work. There are when humans go into the doctor, oftentimes we're asked to fast before we get blood drawn, right?
Mm-hmm.
Is that's the same with birds? Is it for some tests? Like if you get a CBC panel, does your bird have to do any kind of fasting?
That's a good question. That's a good question. And for the most part, with the knowledge and information we have now, unless it's a specific test for your complete blood count and your normal blood work that is done, fasting isn't necessary.
Okay, a lot of birds will be happy to know that. So there.
Yeah.
Especially Amazons. All right. I have a question from Frank. Can gabapentin make my Amazon parrot very sleepy and lethargic? It's spelled GABAPENTIN. Did I say that right? Gabapentin.
Right.
Well, tell us what that is and what it does.
Well, it's a let's put it this way. It's just for ease of understanding, it's a drug that is given that is oral, that I believe we don't know everything about, but For the most part, it's increasingly being used as an alternative to because we use meloxicam, which is an NSAID, which is like Advil. Okay, it's in that classification of drugs. Gabapentin is another class of drugs that is used for pain management for the most part. And within that class, we don't know quite everything. There's not a lot of information on the benefits of it, but it appears just through anecdotal evidence or clinical experience of using it in birds that there is some benefit for pain relief. So with that in mind, this is something that if again, depending on the dose, depending on the species that it's given, that it may, if Frank notices that, well, if I don't give it, it's much more active and much, much brighter and alert and going around vocalizing. But once I give it, then yeah, there's a cause and effect there. So you could look at that and see, and obviously that you think there may be a connection, but it is possible that you have somewhat of a depressed attitude if this is given. I haven't noticed it. We utilize it, and I just haven't noticed that being that obvious where we have that, but it wouldn't, to me, be out of the possibility of occurring. So with that, I would say try it, meaning don't give it. See if the bird is much more active or whatever, and then if he doesn't need it, then by all means, he's doing fine, then don't continue to give it. That's always usually with pain. That's what we look at. If we feel like, well, he's been on pain medication for a period of time, and I think that there's no evidence that there's pain there, then we'll take it off. And no different than if we have a sprained ankle or some kind of oh, I'm sore, I got I hurt myself, and take some Advil, and then the next day or so you say, well, I don't need to continue to take Advil, it's better. And so you could do that. But if the bird is like, oh, it's more active or what have you, then if you don't give it, then it becomes less active. And you feel like, well, it's limping now. I need to give it some pain, I need to give it some medication because it wasn't limping when I was giving it to him. Then by all means, start it again. What you may want to look at there, you say, well, then I give it, and then it's maybe you're given a higher dose than needs to be. You may want to talk to your veterinarian about reducing the dose. With all of these species that we have, the studies that determine what the correct dose is, we don't have that. And so these doses are extrapolated from, meaning they're taken from, possibly done on chickens or done in parrots, and now we're giving it to a Derbian parakeet, or we're giving it to a bare-eyed cockatoo, and we've never done studies on bare-eyed cockatoos. Where can you find 20 bare-eyed cockatoos to do a study on? Australia, but you see what I'm saying? So sometimes we have to regulate those doses and talk to your veterinarian. If your bird, what we do when we prescribe medications, we try to give what the side effects are. These are side effects of taking this drug. if you see something that's problematic, and this is why this is such a great question, call the veterinarian's office and talk to the nurse or talk to the doctor and try to tell. And so it may be well, let's reduce the dose, instead of giving half a mil, give 0.25 mils. And so it's something that this isn't unusual to occur with the birds, because all of the species that we have a lot of information, but we don't have information on all of the species out there.
Okay. And then we have a question from Amy about, are electric fireplaces safe to use with birds in the room? The ones you plug in?
If used appropriately, one thing about heaters or heat lights or heat sources, and people may have think back and say, oh, I remember that. Whenever you have some type of a new device, heater, something, when you first turn it on, you get this smell usually. And so if you have a heat light or a heater, a new heater or something like that, make sure that you turn it on and don't have the birds in the room for the first day or so, because there are things that are components and parts of that there's coatings on that burn off and vaporize, and that's the one thing that I would stress about that. But I haven't heard anything about electric heaters or anything like that would be problematic if used properly.
Okay, maybe open a window or ventilate
Yeah.
too, right?
Yeah. Initially, yeah.
Okay, I guess that'd defeat the purpose over long term if you're.
Well, you
Doors and
read
windows.
my mind. My little mind, my lights were flashing up here.
Like you're trying to keep warm and cold at the same time. All right, so we have a question from Pat, and they want to know what the signs of respiratory illness would be in a bird. What would they show?
Oh yeah, that's an excellent question. As always, we get excellent questions from our the attendees. The signs of respiratory, as far as the obvious signs of respiratory are, of course, open beak breathing, where the birds and that's pretty acute. That's something that's causing difficulty for the bird to get air into the trachea, into the lower air sacs. Then also one of the main respiratory issues is the nares, the nostrils, and they're at the kind of the top of the beak. And the one thing that you'll see with birds is that they can have respiratory discharge around these nares, and the feathers are matted. It's easy to see if you've ever had a bird that they'll be discolored around the nares and they'll mat, even if you don't have drainage coming down the beak, nasal discharge coming down the beak, which of course is something that does occur, and that's obvious. And the kind of the one sign that you look for is the tail, and we've talked about this, is that birds don't have a diaphragm. Birds don't have a diaphragm. They have air sacs, and so really you could go into what would be the abdomen, and you can look at the liver and the kidneys, and then take the endoscope and look at the heart from the same opening that you're using the endoscope. So they don't have a diaphragm. They can't do that in a mammal. because the diaphragm would get in the way. You'd have to go through the diaphragm to see the lungs and the heart. With that in mind, the birds breathe using their abdominal muscles and their rib muscles. And so they breathe like a bellows. And so when they breathe, when they open that, then air comes in. When they depress it, air goes out, in, out, in, out. Okay. So how does this relate to respiratory disease? Well, it relates to respiratory disease because if you look at a bird's tail, when they're breathing, it's normally like this. When the bird has difficulty breathing, the tail does that every time the bird breathes. You know, in, out, in, out. So that's called tail bobbing. So if there's a tumor, if there's fluid, if there's egg that's causing a reduction in the amount of respiratory capacity in that bird's body, it doesn't have as much. Or if there's something with the lungs, aspergillosis, something like that, that's causing, it's like you run 100-yard or 100-meter dash, and at the end of it, you're bent over, yeah, and your hands are on your knees and your tail's bobbing, right? Because you're, and so that's the thing with the bird. So if they have respiratory distress, then their tail will be bobbing. And there may not be any other clinical signs, but that's what you look at. And so if you have a budgie with a liver tumor that's taking up, 3/4 of its coelomic cavity, or you have ectopic egg laying where you have ovulation and follicles are going in the body and fluid is in there because it's inflamed, and you can't see it, right? Because the belly is between the legs and the perch is, right there. So you can't really see, and they have all these feathers. And so it looks normal. But then when you take it and you feel it, it's like, woo, it's like a big pregnant bird. It could be a male or female with a lot of fluid in there for whatever reason, or a tumor. But you don't see that, but it's causing respiratory problems and the tail's bobbing like that. So there you go. Wow.
And that's just a reminder too, when you're tallying a bird, you can't do it too hard, right? Because you can constrict.
Yes. Yeah, very good. I mean, you can't compress the chest. You could kill a bird just by holding it, where it can't breathe, because it needs to have, that chest has to always be able to mechanically lift and depress. Using the abdominal muscles, intercostal muscles to do that. Mm-hmm.
Okay.
Yes. So you don't want to hold and crush the bird. And I mean, you don't have to crush it. You just have to make where it can't, it's all can't.
Yeah. Yeah. So maybe like, just heading into the holidays, if you have visitors and your bird kind of takes flight across the room, spooks, and someone grabs it, they don't know how to handle a bird, you do have to, right? Like
Oh, yes. Yeah.
Right?
Very, very much so. And birds are fairly hardy. I mean, meaning it's not like they're going to crush it, but at the same time, you don't need to crush it. You just have to hold it firmly for a period of time. I mean, but it's better to get a towel or something and just have the bird and put it back in the cage or something like that, and not have somebody who doesn't know how to handle the bird to grab it, especially if you have a relative that thinks they know what they're doing, and that they can handle the situation. It's better to say, just sit and relax and we'll get it.
There you go. Yeah. Especially with the
So
eggnog flowing.
yeah, have a drink, sit down, we'll take care of it,
Okay. No, I don't know if we've ever had this question before, and I'm kind of surprised that we haven't. I don't know if you've ever addressed this. This is fascinating. Linda wants to, well, Linda, sorry, you're under the weather. She has COVID and wants to know if their bird is in danger of getting sick.
We have not had any issues with that that I'm aware of where there's been a COVID transmission on that from a human to a bird or vice versa.
Okay.
So
are you aware of any conditions that you could pass on to your bird, like cold, flu, any like besides like salmonella on your hands? I don't know. I'm trying to something like.
For the most part, no. There are some things that TB, for one. There's been human to bird transmission of TB, but hopefully, that's not a, and thankfully it's not a big issue, but that has occurred. But rarities such as that. Now, the what I'm talking about here is that where you're infected with something, where you have COVID, and so you can infect a person, where you have TB and you can infect a bird or another person. But when you're talking about salmonella on your hands or something else, of course, that gets into the whole situation of being a carrier in a sense that we're transmitting through being contaminated. You see, where we have a bird that has avian chlamydiosis, and we hug it and we treat it, or we doing something or whatever, or we're trying to see what's wrong with it, and then we go somewhere else with the organism on us and handle another bird, and we can transmit that way, so that can occur. It's not something that is common, but that's probably the most common way humans are involved in transmitting one to the contacting birds and transmitting a disease condition, or exposing them to the disease organism. But it doesn't occur much, but it's more likely than having a disease condition that you can transmit to the birds.
Okay.
Being infected, and like COVID or something like that.
All right. Our next question is about amorous cockatiels. This comes from Kath, wants to know, they have cockatiels get 12 to 14 hours of lights out sleep. They get up 8 hours, and they get lots of time out, up to 8 hours, eat a healthy diet, but the males are still very amorous towards they want to know what the solutions would be, because they separate the males out. They tried that, and I like this phrase. They got major complaints from all the teals about being in different homes than they normally are. There are no eggs yet. Only 2 of the males seem to be kind of interested in the females. They want to keep the females from having eggs. So are they doing everything right? Is there anything else they could do more?
Okay.
Got these Romeo cockatiel males that are
okay, so we have cockatiels and males and females, right?
I believe so, yes. So
Yeah. And they don't want the females to lay eggs.
Yes.
And the males are with the females.
I think they separated them.
Okay. Uh-huh.
But I guess the birds weren't happy with that.
Uh-huh.
Yeah, I'm not. I'm going to assume that there's multiple birds here, like by a little flock.
Well, what I would say is that if you're treating your husbandry and caging and diet is all really good, you don't have much issue there, and that you're doing everything as recommended. The birds are happy, and they're healthy and active. With cockatiels, I would say that the only thing that you could possibly do to reduce egg laying is to or prevent, knowingly have some kind of an effect on stopping egg laying in a cockatiel, is either the desirelin implant for a period of time that would be effective, or surgical removal of the oviduct. And I'm not recommending necessarily for these birds either of those, but I guess what I'm saying is that if a cockatiel wants to lay an egg, it's going to lay an egg. You could discourage a cockatiel from laying an egg by not having a nest box. Having the male in the cage or out of the cage, that's not going to make a difference. I can tell you that from experience. If it's happy and going, and all things are on that are good, and it wants to lay an egg, it'll lay egg after egg after egg. And so what you're doing, I think, I don't know how much effect it's having, really. I think that everything lies with what the cockatiel wants to do. And so you've just been fortunate. And as far as the amorous behavior, that's something that that you can't control either. So
can you safely house two hormonal male cockatiels together? Like, will they get aggressive with one another if they're both kind of really hormonal around hens? Is that?
Well, I mean, in general, with birds, and humans alike, there's the pecking order.
Yes.
And so that for the most part, and it depends on the cage and the size of the cage, and it depends on the birds, but I haven't really had a lot of cockatiels. I don't recall a cockatiel coming in because it was beat up by the other bird. In a lot of situations, there's going to be a general understanding. They're going to develop that where, hey, you're below me, I'm top bird in this cage, and we'll live with that. And so there's plenty of feed, there's plenty of water, so they get they make it. But now there could be situations where there's more of a physical abuse with the two male cockatiels, but I haven't really had a problem with that. I know that I've seen birds, cockatiels that have been housed in that situation. So I think for the most part, in cockatiels, budgies, things like that, that the birds determine their hierarchy in the cage, and there's enough food, water, everything to go around, and that they can live together like that. Now, that could relate, in larger parrots, that's not necessarily the truth. And then also with smaller parrots, going to see larger parrots to try to make friends. I've treated a lot where when they go to introduce themselves, the bigger parrot just rips their beak off and then says, well, how do you do? You know, don't come back. And you think that helps? You know, we treat that. And then the next thing you know, the bird goes back and rips the other beak off. You know, they don't learn. So you want to try to make sure that you don't have little bird going to see big bird, and all it takes is one time. And so we'll see that. And then larger parrots, often, you know, there can be issues with interaction between the same sex in the cage with that, where there's issues on that. So anyway.
Okay.
Yeah.
Well, speaking of a beak, I have a beak question for you from Sandy about African gray's beak grows a lot, even after getting a beak trim. He has toys to chew on, but what else do you recommend? Do you recommend grooming perches, pellet diet, blood work to check the liver? So she seems okay otherwise, but the gray has the beak seems to be overgrowing quickly. So
yeah, sometimes the older the bird gets, that we'll see the beaks grow longer. The one thing is, of course, you need to keep it trimmed, and then what you're looking at is it doesn't hurt if the bird has not had a especially if it's an older bird, if it hasn't had a kind of the blood work, the CBC and the chemistry panel, that should be done just to see. And you can do the bile acid test also. A lot of times that what you'll read is like, oh, it's a long beak, so it's possibly a liver issue. I still am trying to, and I've heard that for about 35 years, and I still don't follow the connection between the beak overgrowth and the liver. I just, you know, somebody has to educate me on that because I can't see it. And so, you know, can say, well, this possible, yeah, but nothing's been proven to me. Although it may be, you could get it checked, but everything you read about, oh, it's a long beak, it's a liver. Well, where's the evidence? You know, I'm still waiting for it. And the claws don't seem to grow quicker. You know, why the beak? And so, but I say that because that's what you can read. And so you go and you look at, there may be a little bit malocclusion there that's causing it. I don't think anything like giving it things to chew on or anything like that's going to stop it. I don't think that that's going to slow down that beak growth. It's going to be helpful in the health of the animal to continue to use the beak and keep it strong, and the muscles and then the structural stability of it. That's all going to be good. But when you have growth and just about every species, I've had blue and gold macaws where the beak's gone around. It's like almost like a ram's horn, you know, that we've had to trim back, or a clectus that had the beak's almost in the chest. But it's, you know, so this happens. But you know, in general, we've trimmed those beaks back. We've looked at it. If there's no real and we looked internally with the blood work, and we can't seem to find any problem with many of them or most of them. and they live for years, like getting their beaks trimmed. So that's a great question, and I'm glad to be able to share some of because you go to the liver issue, and like I said, I'm still trying to find some evidence that there is a direct connection and an explanation on how the liver issue is causing that beak to grow. There's only been speculation. There's been speculation for 35 years, and nothing's advanced in 35 years on that. So it continues to perpetuate. But many times it's you look straight on and you look to see if there's any malocclusion. Some of these, there is no malocclusion, and that beak just grows quicker on that.
Is that something that a grooming perch would even help in any degree?
I mean, a grooming perch, again, you can try it, but usually that keratin is just so strong, it's not going to wear it down. By all means, try that. And again, things to chew on, and try it and see, because there's nothing wrong with that.
Yeah.
I'm just not too optimistic that it's going to have much of an effect, and that you'll just need to continue to have it trimmed back periodically. But no, give it a try. Yeah.
Okay. And then we have a question about a budgie parakeet. Gabriella wants to know, do you think it's a problem if parakeets eat a diet of only millet seeds their whole lives? And there's a second question. Have you seen parakeets with stroke-like symptoms? Yeah.
Well, good questions. One, if I saw a parakeet that had a stroke, I would need to be able to diagnose that. Yeah. Otherwise, it would just be, I think the parakeet died of a stroke. That's what the good question is there. So unless I was unless I had some way to back up that bird died of a stroke or an ischemic event in the brain, okay, where the blood didn't get to this and it was a fatal flaw, and that the bird boom, it died because something at a certain part of the brain was it stopped the ability to breathe or something like that. So all you can do is you can say, well, I think it died of a stroke. Now, is it since the birds have vessels in the brain, and the brains, and so they're, and as humans, I don't, what I'm going, where I'm going here is that there's no reason that budgies should be different than other animals, and say budgies don't get strokes. You follow me? So I would say that I would bet that some budgie somewhere has died of a stroke. Okay. And but it's not evidence of that, how often or whatever. We just don't have the information, where we have a lot of budgies that are going through necropsies or postmortem examinations looking at the brain to determine if there was evidence that were consistent with a stroke. Even then it would be speculative. So that's why that's a great question, because it kind of gives you an idea of how to kind of think about that. And so there was also the question as far as budgies being on a millet diet. Okay. And so can budgies survive on a millet diet? Can we survive on, let's say, once we get to be a mature, say we're, so we're weaned, can we live on McDonald's hamburgers or Wendy's, or let's don't say just McDonald's, but Whataburgers, for instance, for our entire lives, you know. So the question, you know, can we probably could live quite some time. How long? Maybe not as long as if we had more of a diverse diet and a more a diet that would include more nutritious offerings. But so with the millet diet, budgies are seed eaters. You know, you go into their native habitat in Australia, there's a lot of seed out there, but they have a very diverse selection to give them what they need to survive. And I would say that budgies in captivity survive a lot longer than they do well, you know, as a pet, would survive a lot longer than they do in the wild. So you people fed budgies millet for years, and you had budgies that lived quite some time. Is this optimum? I would say that it's not optimum just to feed them millet, but they can live on it. It is, you know, I do give mine millet, but I give them pellets, and the pellets and the millet. And so they, and I don't give them the millet so they don't say, I don't want to eat pellets, I'm just going to wait for the millet. No, they got to eat the pellets. And so they do. And then also with the nutriberries. And so it's all involved to give them the best chance of, in the pet setting as a companion bird, or in the pet setting, to give them the best chance of getting optimum nutrition to live the longest, happiest, healthiest life that they can. And so, you know, that's my thoughts on that.
Okay, so you ready for, I think this will be our last question of the day of the session for today is going to be from Susan. And she wants to know, if a bird's feet feel cold, does that mean that they are cold too? I love this question because I always wondered this myself. If the bird's feet are cold, does that mean the bird's cold? You know, we get cold, right?
No, it doesn't. It doesn't, because what do you look at when a bird's cold? That's the thing. What if a bird is cold? And it's well, Merry Christmas. What questions do we have today? Great questions. So a bird is cold. Okay. So how do you know if a bird's cold? Is it shivering?
It's shivering.
You know, like, it needs my hat. Needs my hat.
You can't really, yeah, like dogs you put sweaters on. I mean, like, but birds are a little trickier.
Yeah, but how do you know if a bird is cold, though? You see, so that's the question. And so we've heard about birds being fluffed, right? So what happens when you get cold? What's the first thing if you're going to be hypothermic? What happens? All of the things, all of a sudden, you get goosebumps, right? That's called piloerection.
Wow.
Your fur on your body is standing up. Okay. And so what happens is, so for a bird, my bird's fluffed on the bottom of the cage. When a bird is fluffed, you go outside and, you know, in the winter, and you look at a little bird, it'll only be a puffball, because it's got those feathers up and it's trying to get that air under those feathers as a barrier for the heat. So if a bird is cold, it's going to be fluffed, because those feathers, like goosebumps, it's going to go up. And so that's why if it's a sick bird and it's fluffed on the bottom of the cage, well, it's fluffed because it's bird's temperature, normal body temperatures are like 105, 106, 107 degrees, right? Whoa. And so birds' body temperatures can't go much higher, they die. That's why heat's more problematic than cold. And so when a bird, we don't take the temperature of a bird when it's sick because it's not going to be elevated, it's dropping. I mean, if we want to know what the temperature of the bird, if the bird is like really cold, we normally take temperatures when we're doing surgery and everything to maintain body temperature. But we know when they're sick, they just go straight down, and so we know that we need to put them in an incubator. We need to heat them up. So if the bird's feet are cold, but it's, going around, the feathers are normal or anything, the bird it's not cold.
So what you're saying is you don't need to put slippers on those 2 toes forward and 2 toes.
Well, there's a business opportunity.
There you go. If you can get them on them.
A business opportunity right there.
That would be very specific. We do have, if you don't have time, I mean, if you have time, we have another question. One more. Can we fit in one more since?
Well, it's Christmas and why not?
You're feeling the holiday spirit here with you. Okay, this one comes from Bonnie. Any suggestions on how to provide humidity to a bird besides the shower and steam in the bathroom? Even a warm air humidifier makes the air chilly. So how do you provide humidity to a bird besides using the shower or bathroom steam in the bathroom?
Well, that's a good question. The one thing that you're looking at here is that thinking about it, how problematic is the low humidity for the people and the bird, and I know that the humidity can get rather low in certain environments, and then if you're providing you have a humidifier, they have humidifiers out there. And I think that you look at the air temperature, the ambient air temperature, if you're looking at a house that has a certain amount of circulating air that within it, that's regulated by a thermostat, that, as I've mentioned, the birds adapt, and it's going to be generally cooler in the winter in the house and generally warmer in the summer. And as the temperatures drop in the winter, in the fall, the birds adapt by putting more feathers. They have more feathers that they grow as it gets cooler, and then they'll lose the feathers when it gets warmer. And these are smaller feathers, under down feathers. And like I said, I can tell the difference from a bird being outside in Louisiana in January and a bird that's inside. I can tell, by the amount of feathers on that bird. So you're talking about the temperature, even though the humidifier gets it's not warm. Well, I don't think it needs to be warmer than what the ambient temperature is in the air. So if you have a humidifier in the room, the bird is going to be fine with that. That's livable within that environment for the humans. So it's not going to get cooler, so to speak, on that. So you don't really have to worry about that, and put the humidifier in the room and the bird will be fine.
Okay, there you go. That's our last Ask the Vet question, I think, in 2022. It's gone by so quickly.
Where did it go?
I know. I know. Well, we'll have
So
to.
much to look forward to in 2023, right?
Yes, definitely, for sure. Oh, and before we get to 2023, though, I gotta announce what we have happening next Tuesday, or this Tuesday coming up. We have we have a special date and a special time of our holiday webinar with Lisa Bono. We got some giveaways. It's like if you were with this last year, yeah, we're gonna have some product giveaways that you definitely want to tune in for. So yeah, on Tuesday, it's going to be an hour earlier than our typical time. So for example, 11 a.m. Pacific Standard Time is our Christmas special, our holiday special, sorry, our holiday giveaway special is on Tuesday. So you gotta join us then. That's going to be super fun. Some great products. Lisa's going to walk us through what's the latest and greatest for birds. And yeah, so you have to be present to win. That's
Don't miss it. Don't miss it.
Don't miss it. Yes.
Santa's there.
That's right. So everyone gets your holiday festive clothing, or get in the mood, because we're gonna have a wonderful holiday party on Tuesday. And as I also got to give our giveaway today. So our giveaway, who's winner? Okay, today's winner of our giveaway is Rebecca Frank. Congratulations, Rebecca. You are going to get, I believe, Lafeber foraging pack, as well as another Lafeber product of your bird's choice. So that is, yeah, there we go. So so Brenda just reminded me, we've got King's Cages tabletop tree, Austin air purifier, a Packle bird. These are some of the top prizes. So yeah, so join us on Tuesday, an hour earlier than our typical time, 11 a.m., which is 11 a.m. my time instead of 12. So if you're in Cal, West Coast. But wait, what time is it your time right now? You're like 3 o'clock?
3 o'clock. Yes.
There we go.
Yes. And they could go. Yeah. And who knows who's going to be on the webinar, because it could be, in the middle of the night somewhere. And
that's true. Yeah.
So there you go.
North Pole could be joining us,
Yeah, Rika. Yeah.
All right. Well, Dr. Tully, I mean, seriously, thank you for all of these webinars that you've done this past year and the year before and the year before. I think we've done quite a few Ask the Vets. It's been awesome. So, and
we get good questions all the time. It's fantastic. It's our great attendees that are bird owners out there, and veterinarians, and everybody that attends and makes this a learning experience for all. I just, it's wonderful, and really thank Lafeber for supporting, and you and Brenda for the team here, and I want to wish everybody again happy holidays, Merry Christmas wherever you are, and a happy 2023. So thank you.
All right. On that note, we're gonna leave it at that. That's a nice warm wish for everybody here. So yeah, so till next year, I can't wait to see we get questions for you. So
all right.
On that note, everyone have a great weekend. All the best to you and your flock, and everyone stay safe. And I'll see you all on Tuesday for a holiday webinar.
Bye. Bye.